Firmagon instructions for use. The content of this video is intended to demonstrate the steps involved in giving an injection of Firmagon. Please be sure to read the full instructions for use that is included with the medicine before administering an injection of Firmagon. Firmagon is administered as a deep subcutaneous injection in the abdominal region only. A Firmagon 240 mg starting dose is given as 2 subcutaneous injections of 120 mg. Maintenance doses are administered monthly, every 28 days, with the first Firmagon 80 mg dose given 28 days after the starting dose. In addition to the items in the kit, you will also need the following. Before you begin the injection process, be sure to wash your hands with soap and water. First, uncap the vial containing the Firmagon powder. Wipe the rubber stopper on the vial with an alcohol pad. Carefully peel open the vial adapter. It is important not to touch the sterile spike inside of the adapter. Next, be sure to firmly press the vial adapter onto the vial containing the Firmagon powder until the adapter snaps into place. Then, pull the packaging off the vial adapter. To assemble the syringe, insert the plunger rod into the back of the pre-filled syringe. Then, screw the plunger rod clockwise to tighten. Also, be careful not to pull the stopper or flange off of the back of the syringe. To transfer the sterile water from the syringe to the vial, unscrew the gray syringe cap attached to the Luer lock adapter on the syringe. Be sure not to pull off the Luer lock adapter. Carefully twist the pre-filled syringe onto the vial adapter until it is tight. Be careful not to over-twist the syringe. Press the plunger slowly to transfer all of the sterile water from the syringe to the Firmagon vial. The reconstituted medication must be administered within 1 hour after the addition of the sterile water. With the syringe still attached to the vial adapter, gently swirl the vial until the liquid is clear with no powder or visible particles. Be sure not to shake the vial, as this will cause bubbles. If the powder adheres to the side of the vial, tilt the vial slightly. A ring of small air bubbles on the surface of the liquid is acceptable. Reconstitution time can take up to 15 minutes, but usually takes a few minutes. Now that Firmagon is reconstituted, you must transfer it back into the syringe for injection. To do so, turn the vial completely upside down and pull the plunger to withdraw all of the reconstituted medicine from the vial to the syringe. To expel any air bubbles, press the plunger to the line marked on the syringe. Now that the medication is in the syringe, carefully unscrew the vial adapter and the empty vial from the syringe. Then, screw the injection needle clockwise to attach it to the syringe. When you are ready to administer the injection, select one of the 4 available sites on the abdomen. No injection should be given in areas exposed to pressure or irritation, such as around the belt, waistband, or close to the ribs. Be sure to note the injection site for reference at the next treatment and vary the injection site to minimize discomfort to the patient. Once you have chosen the injection site, clean the skin with an alcohol pad. Move the needle shield away from the needle and carefully remove the needle cover. To perform the injection, pinch and elevate the skin of the abdomen. Insert the needle into the skin at a 45-degree angle all the way to the hub of the needle. To be sure you do not inject into a vein or muscle, gently pull back on the plunger to check if blood is aspirated. Perform a slow, deep, subcutaneous injection over 30 seconds. Trauma can occur in the dermal layer if the product is injected too fast, which could result in a reaction. Be sure to inject all the medication in the syringe before removing the needle from the abdomen. Once the needle is removed, continue to hold the skin for approximately 15 seconds to allow the injection tract to close. Then, release the skin. After the injection is complete, place the needle guard over the needle and dispose of the entire syringe in a sharps container. Once the injection is complete, be sure to instruct your patient not to rub or scratch the injection site. It is important for them to keep the injection site clean and wear loose clothing to avoid irritating the site. Inform the patient that they may feel a lump at the injection site and experience redness, soreness, and discomfort for a few days after the injection. This lump is a depot, or medication deposit, that forms after the injection. It supplies the body with a continuous release of Firmagon over time and will eventually subside. Remind your patients to call if they have any questions and to schedule their next dose of Firmagon.